Hello everyone, welcome to Diabetes Per Charcha talk show, and today we are here at the Diabetes Conference. It's held in Chennai, and I have with me Dr. L. Meenakshisundaram, who is a senior diabetologist. A very warm welcome to you, doctor. So before we get into the program, I kindly request you to share some few words about you to the viewers.
See, I am Dr. L. Meenakshisundaram. I did my MD General Medicine from Madras Medical College. I've been practicing internal medicine and diabetology for over 30 years in Roypata and Mylapore, Chennai. So we have got over 10,000 diabetic patients whom we monitor regularly. So we do a lot of work in diabetology in Chennai.
Doctor, I would like to understand what is this HbA1c test?
Yeah.
It's normally considered this test is very good one for diagnosing diabetes. So can you just share it?
HbA1c means hemoglobin A1c. It shows the average blood glucose for the past 3 months. It's one of the best tests to show the control of diabetes and the prognosticate about the complications of diabetes. Normally, if it is below 5.7, that is normal. If it is between 5.7 to 6.5, it is pre-diabetes. Above 6.5, it is diabetes. If you are a diabetic, it is better to keep your HbA1c between 6.5 to 7 so that the long-term complications of diabetes can be prevented or completely avoided.
So what are the complications we see in diabetes and how dangerous is it?
See, that's a very important question. Type 2 diabetes can cause multiple complications from head to foot. Diabetes being a silent disease, it can slowly affect most of the organs in the body. Particularly, there are two major complications: the microvascular complications and macrovascular complications. The microvascular are retinopathy, which is the involvement of the retina, and neuropathy, which is the involvement of the nerves, and nephropathy, which is the involvement of the kidneys. And coming to macrovascular complications, it can cause a stroke, it can cause a heart attack, or it can cause a peripheral vascular disease. So these are the major complications. In addition to this, other organs like skin can be affected, gastrointestinal tract can be affected, most of the organs can be affected. That's why you have to keep your blood sugars under good control to avoid all these long-term complications.
What will be the message that you would like to share today to our viewers, especially in prevention and controlling diabetes?
Yeah, see, diabetes has become a major epidemic in India. So we are seeing increasingly younger and younger individuals in the 20s and 30s, particularly in the IT field, develop diabetes. So to prevent diabetes, what are the major things? Number one is maintain your weight. Try to maintain your ideal body weight. Avoid obesity. Number two is avoid junk foods. Number three is exercise regularly. Number four is reduce your stress level. And like you can practice yoga, meditation, pranayama, etc. Number five is have adequate sleep. So enough sleep is important. And if you do all these things, diabetes can be easily prevented. Or even if you develop diabetes, you can prevent the complications at least. Thank you.
Thank you so much, doctor. Sure. So that was Meenakshisundaram for us, who has given us a lot of information today, and I hope the viewers would have benefited out of it. So if you have more queries, kindly do check out our Facebook page called as Diabetes Per Charcha. We are also there on Instagram, Twitter and YouTube. Thank you so much, doctor, once again.
In association with